Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you are having a terrific day. Today in this video, we're going to talk about tight fascia can cause headaches. So this is crucial information for those of you that are chronic headache sufferers. You might have headaches daily, you might have it every once in a while, but either way, it can be very uncomfortable and cause a lot of issues in regards to being able to do your work or being able to do your activities of daily living. So these headaches, they might have a deeper root. It could be the fascia that's causing the issue, and we're going to talk about that today. So stepping back a little bit, what is fascia? So fascia is the connective tissue that lies underneath the skin. It wraps around bones, organs, muscles, ligaments, nerves, tendons, and it connects everything together. It runs deep, it runs wide, it runs lengthwise, when it gets tight, it can cause a lot of irritation around an area locally and also further away. How can fascia cause headaches? So when the fascia becomes tight, what can happen is that it can irritate those pain-sensitive structures, the bones, the muscles, the tendons, ligaments, nerves. It can cause spasm in an area. It can cause the muscle to become tight, potentially causing trigger points in an area, causing pain towards the head, or giving that sensation of your head being off. The fascia can cause a lot of pain and dysfunction, again, locally or further away. The key thing is that when it does become tight, it can cause a lot of problems towards the head and towards the face. In particular, it can cause those issues, as mentioned before, towards the head and the face. These are the common locations. These are some of the common locations where fascia can become tight and cause headaches or symptoms in the head. I say symptoms in the head because there could be something that happens around the face, for example, numbness, and it's not necessarily headache, but it's towards the head. So I'm kind of putting it all in one umbrella. So here are the common locations. The first one here seems fairly obvious, around the scalp. So it can feel very tight around the area. In fact, I like to work on the scalp because there are a lot of muscles in the area that can become very tight and cause a lot of headaches in the area itself. And also, there's pressure points, acupuncture points that are there that I can work on also. But when the fascia becomes tight, it can cause pain, potentially spasming of muscles in the area. The second one there, right here I'm pointing to, is the upper back, shoulders, and the back of the neck. This is probably the most common one that I've seen. So that area, when it becomes very tight, can cause muscles such as the upper trapezius, this muscle up here, to become very tight, potentially have trigger points in the area, giving you headaches to the back of the head. You can have the restrictions sort of lower down here around the lower trapezius. This muscle here, when there's trigger points in the area, you can get referral up towards the base of the skull, giving you headaches to the back of the head. This third one here is the front of the neck. When this area becomes very tight, usually from a head forward position, it can cause muscles in the area, such as this muscle here, sternocleidomastoid, to have trigger points, causing you head and face symptoms. And finally, this one here, the fascia on the chest. So this kind of goes hand in hand. The chest fascia, when it becomes tight, and the front of the neck fascia here, when this area becomes super, super tight, it draws your head forward. It causes a lot of issues in terms of this muscle again, sternocleidomastoid, and also the back of the base of the skull, they're the suboccipital muscles. And they can give you referral towards the back of the eye. This is the suboccipitals I'm talking about, towards right above the ear and behind the eye. The sternocleidomastoid, it'll give you facial symptoms, sometimes weird symptoms in the ear. So those are common locations where fascia can become tight and potentially cause headaches. So let's talk about how a typical treatment might look. So the person might come in and they've had potentially treatments before. This is a typical case. They come in, they've had multiple treatments from different therapies, different therapists, And the common thread that I've found is that the work is generally more on the muscle. And the thing, though, that is that there's nothing wrong with that. The issue is that it may not be the root of the problem. It could be that the fascia is causing the muscle to become tight, maybe causing it to spasm, potentially, maybe predisposing the person for trigger points, like in areas such as the upper trapezius, which again gives you headaches to the side of the head, the temple. It could give you headaches towards more of the face, back of the head. So what I do is I look at the health history, as all massage therapists and all healthcare providers do, and I look for clues in regards to something pointing towards the fascia. So it could be that they've had again the muscular types of treatments. I'll delve deeper into the questioning if I feel that it might lead me towards the proper treatment. The other thing, and the main thing that I do, is actually I palpate, or I feel. I use my hands to observe what's going on. So if I pry it with the tissues, what I'll find is if it's primarily fascia, it'll be stuck. It'll feel like it's glued on to the muscles. And what I try to do is I peel it off the muscle. It sounds very graphic, but that's basically the case. When I find that the fascia is the issue, the primary issue, the root, and it's just causing the muscles to react a certain way, potentially giving the patient the headaches, the chronic headaches, I will zone in on the fascia, get it to loosen up. And the reason why I do that is because if I just work directly on the muscles, I may not get the response I want. And that response is basically to relax the muscles, decrease the amount of trigger point activity. So by releasing the fascia first, what happens is that the muscle actually relaxes a lot. There's more of a relaxation effect on the muscles, and therefore I can actually access those trigger points better, work on those muscles so that they're definitely a lot looser. So it's a step-by-step process. There is a sequencing in terms of how to go about working with the tissues so that I can decrease these chronic headaches, potentially neck pain also. So that's a typical treatment. And yes, it can be very painful depending on the degree of tightness the person might have. I might be working on the fascia for 30 minutes to 45 minutes. And that does sound very painful because it can be very uncomfortable for sure. But over time, what happens is as the fascia relaxes, the muscles are, I'm better able to get into the muscles to get to relax so that we can decrease the headaches. And usually what happens is that the person has more of a longer term effect in terms of managing their headaches when we treat the fascia first. So we want to thank you for watching. We really appreciate it. Please follow us on our social media. Please like, share, subscribe, and pass this on to those that you feel this might be helpful for. We want to thank you in advance. If you have any questions, feel free to give us a call at 416-644-8894. You can also email us at admin@ventepainrelief.com. Remember, our office is at First Canadian Place, King and Bay Financial District in Toronto. Thank you again for watching. My name is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. See you in the next one. Have yourself a great day. Take care.